Hi, I'm Charlie Hogan, and I'm going to be presenting my evidence-based practice paper today through this PowerPoint I created. My evidence-based practice focuses on simulation in nursing education. So I chose simulation in nursing education because to me it is one of the most vital components of nursing education, especially since we are seeing a shortage of clinical sites. I also chose this because as an undergraduate student, simulation really impacted me as a future nurse. I remember one of the scenarios that I did to this day where the bed rails were left down and the mannequin was on the floor, and I never forget to put up bed rails ever since that scenario. So I know how important and vital it can be to nursing students, and it is something that I really think is vital to nursing education. So simulation in nursing education. It allows the students to put theory into practice. And this is very important because if students go in and they have never put theory into practice, they will not have the confidence, they will not have the skills needed to provide safe and effective care to the patient. And one way that we see this is the lack of clinical sites. These students are not getting to place this theory into practice. And so with that being said, we're really relying as educators on simulation to make up for this lack of clinical sites. And the educator's role in simulation, this is what I focused my paper on. My paper's aim was to show how that educator's experience is vital to the learning outcomes of students in simulation setting, and how can educators improve these learning outcomes, and what are the components that simulation includes that need to improve these outcomes. So educators' experience in the simulation setting really makes a difference, and this is something that a lot of nursing programs now, due to the shortage of educators, aren't really focusing on, and that is vital to improving the student learning outcomes. And so we really need to take notice of the educator's experience in order to improve the student learning outcomes. So a little bit about the simulation background. This was very interesting when researching this, especially after finding out that it first started using rocks and clay to develop female anatomy. Back previous generations, females were very modest, and they would not allow for physicians to look in areas that nowadays we just, females are not as modest as they used to be and are more willing to allow doctors and even male doctors to look for their OB exams. So Phantom, he was created from a woman's pelvis, and they utilized a dead infant to create scenarios during the childbirthing process of what could go wrong, such as a cord prolapse. So they would create this scenario and teach physicians on what to do in order to decrease these infant mortality rates and even the mom's mortality rate. And while it seems kind of gruesome, it actually, they saw an improvement in the mortality rates for both the mom and the infant. And so that's kind of where simulation really started. And then we saw where Harvey was developed, and this was used for cardiac disease processes and scenarios. And so this was used for the doctors and the nurses. Then during these intense scenarios, they educated the nurses and physicians on what to do. And this Harvey, he had the oscillatory findings as well. And then we developed the high fidelity mannequins, and this is what we are utilizing today in our simulation settings, and they are great. They can cry real tears. They will actually have mannequins that will birth a child. So we're definitely moving forward in the process from back when Phantom was created. So we are seeing these mannequins become more and more real life, to say, and so we are able to create these scenarios that are real life without these real life consequences. So we are definitely giving our students the ability to act in these situations without these real life consequences. And then we also utilize actors. So actors can be utilized for like family or the support person or whoever's with the patient for that particular scenario. And this allows the students to learn communication and to acknowledge that there are going to be other people that you're going to have to talk with in the room besides just the patient. And so that's something that is really important that we teach our students, how to communicate with not only the patient but the family or the support person. And then the scenarios. So scenarios can be actually pulled from different resources like websites, or they can actually be created by the university, by the educators there. Or they can take a scenario that's already created from a website and adapt it to their learning outcomes. So definitely the educator has a lot of control in the simulation setting. And that is why it is so vital that we make sure that these educators are prepared to educate these students in the simulation setting. That way we are improving these learning outcomes. So improving learning outcomes. So what will improve the learning outcomes? The one thing that I notice that the educator really needs to focus on so that we are allowing these students these learning outcomes is creating that safe environment. This safe environment promotes trust in the educator, and it also allows them to go into a scenario and act, not hold back, but actually perform in the manner that they would if they were at the bedside. And that's going to improve their learning outcomes. And how do we provide a safe environment as an educator? We promote trust with the students, but we also, this is something that I suggested that all nursing programs have, is a contract with the student saying, hey, I will not discuss outside of simulation the scenario or talk with other students about the other students' performance. And that is so important. And then having consequences for those students that do go out and talk about this, because scenarios can take forever to develop. It takes time, and it also, when students are talking about other students, they're not going to perform the way that they should in these simulations. So we need to set that tone of a safe environment for these students. And then controlling the environment in simulation can improve the learning outcomes. So that's where an educator's experience really comes into play too, because you can have this scenario ready to go for these students, and they get in there and they ought, like, the time frame, oh, they have 20 minutes to notice that this is a blood transfusion reaction. Well, they get in there and they notice right away, and then they start going on. So then the educator needs to be able to adapt to this scenario and be like, okay, so let's just continue the scenario on and maybe meet these learning objectives outside of these objectives. So just improving the learning outcomes. And then promote confidence. So so that goes back to controlling the simulation. So you can see where students are suffering and create these scenarios based on that, but you also need to make sure that you're promoting confidence, because if they always feel beat down when coming to simulation, they're not going to perform as well, because they're going to feel like, oh, I'm just stupid, when they're not. So we want to promote that confidence, because we want them to be confident, because they cannot provide patients with care that is safe and effective if they are not confident. And they're constantly beat down or feel that they're not meeting these learning outcomes, they are not going to be ready for that bedside care. And then, so what are the components of simulation? Where do we focus as an educator on improving these learning outcomes? So we have 3 areas that are the main components of simulation. It's the pre-brief, the scenario, and the debrief. So pre-brief, okay? So pre-brief is where we are going to make sure that we always start with the confidentiality agreement. That automatically sets the tone. We are providing that safe environment right then for that student to go in and perform and learn. And that is what we want to do. We want to make sure that is the very first thing we start with. And then we're going to make sure that we go ahead and we talk about the objectives. That kind of gives them an idea of what to expect by going over the objectives. So that helps a little bit with that anxiety they might have if they know, oh, okay, so I kind of am familiar with these objectives. I can go in and I can actually perform in the scenario. And then we also want to make sure that these do not last longer than an hour. And with that being said, that is because of anxiety. Students are so anxious. I remember as a nursing student myself, everything just made me anxious. Everything. I mean, going to McDonald's at that point in my life, I feel like made me anxious. So just making sure that we don't go over an hour, because the longer they have to wait to start the scenario, the more they're going to be anxious. So making sure that we go ahead and do that. And then the scenario. So that's where the educator can control it. And we want to make sure that we're going to be able to make sure that the scenario also allows the students to meet the learning objectives, and it allows them to mess up, but also it allows them to do something right. That way we are promoting confidence, but we're also promoting the learning outcomes that we need. And then we also do want them to mess up, because, you know, you learn best when you do mess up. And then debrief. So debrief needs to be held immediately after a scenario. And the reason why is because we all know, as human beings, something that seems terrible, awful to us, it's always the immediate reaction. As time goes on, that just fades. We're like, oh, that wasn't that bad. But, you know, right in that moment, it feels awful. And so we want to make sure that we're exploring those immediate feelings, okay? We're allowing them to reflect and be like, yes, I did learn that. Okay, yeah, I did mess up on that, but now that I see that, I can go in as a nurse and take care of a patient that has that, because I know what to do. Also, we want to remind students that, hey, at the very end, we are going to discuss, this is not discussed outside the simulation setting, and bring up the consequences, because everything during this paper that improved learning outcomes relied on the educator's not only experience, but it also relies on the educator setting that tone for the simulation. So that is so important during pre-brief and debrief, starting and ending with the confidentiality agreement. Educator's experience. So since we are having this clinical shortage, like I had talked about, it seems that we are just throwing educators in there because now we need more clinical simulation hours and we don't have the staff to cover it. So let's just throw this random, you know, educator in here to teach this. Well, we're not going to see those learning outcomes if we do that. So this is one of the biggest issues that we are seeing right now with simulation. And that is why I focused my paper on this. How can the educator's experience really improve the learning outcomes? And so one way that we can make sure that the educator's experience is where it needs to be is we can have a preceptor program for these educators. If they don't have an experience, or even if they have experience, everything's different at every nursing program. I have seen that with even doing these clinicals, that everybody conducts stuff a little different. So it does not hurt even for those educators with experience to have this preceptor program. And having a preceptor, it allows these educators to ask questions to these other educators and improves their confidence. When educators' confidence is improved, then your students automatically, their learning outcomes are going to be improved. And then accreditation. So accreditation, you have to have experienced educators in there to do that. Not everybody's going to have a ton of experience. I understand that, but you want to at least have a couple, because you want your program to be accredited if all possible. And it's a long process and it takes someone that knows how to do it. And then weekly meetings. Weekly meetings are so important. It allows the staff to get together, the educators, and meet. If they have any questions, or hey, this happened during simulation, what do I need to do? Or this wasn't ready for the simulation, it's affecting my students' learning outcomes. Just getting together and meeting to figure out what needs to be done in order to improve the student learning outcomes. So in my conclusion, I learned that educators' experience is going to affect the student learning outcomes. And so we want our nursing students to be prepared for bedside. It is our job as an educator to make sure that our students are able to go out and provide safe and effective care. That is our job as educators, and that is why we're using simulation for. Simulation promotes self-reflection, which is going to improve learning outcomes, and it improves the confidence and skills of our of our students, excuse me. Overall, we just want to make sure that our educators are experienced in the simulation setting, so that way our students are getting those learning outcomes that we need them to get. If you have any questions regarding simulation in the nursing nursing program, or anything about my research, please just let me know. Thank you.